Well, millions of Americans are living with chronic wounds which may never heal or could take years. Joining us this afternoon is Dr. James Beebe, a wound care physician with Utica Park Clinic. Doctor, thank you so much for being here.
My pleasure. Thank you for inviting me.
Of course, absolutely. Well, staggering statistic here, nearly 7 million Americans have chronic wounds. Of course, that's a very high number. Doctor, can you explain what exactly are chronic wounds and what can cause them?
Yes, chronic wounds are wounds that fail to heal in a normal fashion. We usually think of a wound that would normally heal within 2 to 3 weeks. Unfortunately, with some of underlying medical conditions, these wounds have a tendency to stall out. So a wound that doesn't heal in a 4 to 6 week period is considered a chronic wound, and at that point would need to be addressed as the underlying causes as to why the wound wouldn't heal. What we're seeing a lot of, though, is with the aging population and the rise of obesity and diabetes, we're seeing a lot more diabetic wounds as well as venous type wounds of the lower extremity.
Absolutely. Can you talk about some of the complications that can come up when you have those chronic wounds?
Yes, other than non-healing wounds, we have an increased risk of infection. So that's where a lot of visits in the ER from infection from the chronic wounds. So the idea is to treat the wounds early on to get them healed quickly to prevent ongoing infections and ultimately to prevent amputations. And that's one of our goals. And part of the wound care awareness is to have those patients be able to find a wound care center to be able to get help immediately to prevent long-term consequences.
Absolutely. And doctor, you kind of mentioned this, but talk about some of the treatment. I guess the early awareness is important. So when should you go and see a doctor if you think you are suffering from this?
Yes, the biggest thing would be if you have a wound that you're concerned about, seek help, go to your doctor, and they'll evaluate the wound and then make a referral to a wound care center. Early intervention is the key to recovery for a lot of these wounds. And in the wound care centers, once we evaluate the patient, it's to look at the underlying causes, treat the underlying causes, and to use different types of techniques to help promote better healing for the wound. And that includes not only debridements, but also hyperbaric oxygen therapy, which in some cases can help promote healing in a lot of the diabetic type wounds.
Absolutely. Really important information there, doctor. Thank you so much for joining us today.
Thank you for having me.
Absolutely.